Hello everyone, I'm Dr. Filippone coming to you once again from Knoxville Hospital with your radiology rounds. This week we're going to be talking about peripheral arterial disease, specifically leg claudication. Some of you may experience this when you go for walks. You experience some cramping in your legs or pain in your legs. Usually occurs at the same distance every time, and the only way to relieve it is usually just to stop and take a rest before you continue again. One of the reasons for this is because your muscles require oxygen, and the oxygen is carried by the blood. And if there's something that slows the flow of that blood, such as arterial disease, that can cause that kind of cramping. And the only way to stop that is to rest your muscles so the demand for oxygen decreases. I'm going to go through some slides here, just kind of go through this quickly. I'm not going to say everything on every slide, but we'll hit the high points. First thing, like we were saying, the classic claudication is described by muscles, reproducible pain with exercise that is only relieved by rest. Some of the classic characteristics are cramping, tightness, aching, fatigue. This can happen in the buttocks, the hips, thighs. It is exercise-induced. It happens at a consistent distance. It is relieved by standing, usually less than 5 minutes to experience the relief. Some differential things that can cause this that aren't related to the arteries are different kinds of nerve problems or bone problems, muscles. Other things that can increase the risk of decreased blood flow are diabetes, renal failure, decreased cardiac output. Smoking can exacerbate this. Things that increase the demand for blood flow could also contribute to this, such as infection or injury. Some of the etiologies of leg ulcers can be due to venous insufficiency or arterial disease, something as diabetes, and then some other more rare things, including cancer. What do we usually do to work up patients with this sort of problems? Of course, you would go to your doctor first. They may do a physical exam, which includes a vascular review of symptoms, and then they would also order some imaging study. Comprehensive vascular examination includes a physical exam as well as listening, and then also some ultrasound studies. Differential diagnosis, as we said before, can be anything from stenosis due to atherosclerotic disease to trauma and infection. When you come to radiology, we can do something which is called an ABI, which is an ankle to brachial index. And this gives us just kind of a screening exam to find out if you have a stenosis somewhere. It won't tell you where it is. In order to find out where it is, we would have to do further testing, which we can now offer here with the new machine we just bought, which is something we call segmental pressures, which we would get pressures all the way down the leg and including in the arm, so we have something to measure it against. And we would do this in different areas so that we could find out exactly where that stenosis is. I have an example here. So we would put cuffs all the way down the leg, and we would measure the pressures. We can measure velocities, and we can actually take a look inside those vessels to get a better idea of where the stenosis is, what it would look like, how much of a stenosis we're dealing with. These are examples of different waveforms. The waveforms of the blood changes with different degrees of stenosis. We can also do exercise tests so that we can see exactly how much that demand for oxygen with exercise causes a change in the disease. And again, we can do the color flow, which like you would have anytime you assess an artery. We can actually see the inside of the artery to see where the stenosis is, measure the waveform, measure the velocities. Just another example of that. And again, to kind of go through everything, your first step, if you have symptoms, would be go to your primary care doctor, maybe a specialist. You would come to radiology, and our ultrasound technologist, who is trained for this specifically, could do an ultrasound screening study, ABI, then perhaps move to segmental pressures. Sometimes then, from there, we want to get a better look, and we can go to a CTA, which is an angiogram performed with the CT machine, or an MRA, which is an angiogram performed with an MR exam. So if you're experiencing these sort of symptoms, leg cramping with exercise, please see your primary care doctor, who may then refer you over to radiology. Thank you.